Today we're going to discuss facility total fee comparison in relationship to endoscopic carpal tunnel release. My name is Jeffrey Restuccio, and I'm a certified medical coder, auditor, and reimbursement consultant. My contact information is on the bottom of the screen, and I do recommend you visiting our website, www.IOECTR.com. So the issue is that the total reimbursement for surgical procedures includes the surgeon's professional fees, which are CPT codes, RVUs, and you find those in the physician fees schedule RVU database on the Medicare website. And then also, when performed in a facility, they're billed separately. So an ASC, hospital, outpatient department, or hospital, they bill separately for the facility fees. Now, these can be construed as being the overhead. So this is the overhead of the procedure. Now, numerous surgical procedures can now be safely performed in an office-based surgical suite or OBSS instead of an ASC, HOPD, or hospital. Now, when performed in the hospital, there is no separate facility fee. There's simply the professional fees, and there's typically an increase in the non-FAC PE RVUs. So that's non-facility practice expense RVUs is typically higher. But for many procedures, it's not higher. It's the same, and that's called a zero site of service differential. Now, the overhead, which is a non-FAC PE, even though you can conceptually think of it as being facility fees, an office is never a facility. It's the place service equals 11. It should never be referred to as a facility. There's no way you can separate that or charge separately when you establish an office-based surgical suite. So these procedures, they will have a status indicator of NA, or not applicable, in the non-facility NA indicator field in the 2021 Medicare PFS RVU database. That means there's no additional reimbursement for the OBS, and the site of service differential is zero. There are thousands of procedures with a zero SOSD, and at least 97 orthopedic hand and wrist procedures have zero SOSD. Here's a list of acronyms. These are explained in all of my slides. If you want to stop it here and review these. But here again is the RVUs amounts for code 29848, which is an endoscopy wrist surgical with a release of transverse carpal ligament, or ECTR. The three components of total RVUs are the work, which is the same, the practice expense, notice here, those are the same, and that's our issue here. We would prefer that they not be the same when you have an office-based suite, and then the malpractice, or M here, this is your malpractice RVUs, and here's your total RVUs. So here again, since these are the same, SOSD equals zero. And here's an example of the same procedure performed in an ASC, hospital, outpatient department, and hospital. And you can see that the ASC, the total expenses are higher. HOPD are higher still, here about $700. And then a hospital is a lot higher. So you want to use this information when negotiating for overhead. In other words, your carve out and your tactic is that you're going to save the insurance company total expenses on every patient. Plus, they're going to have a better experience, and you can go over both the benefits and the safety information I have, again, on the website and in separate presentations. But now these numbers, there's a lot of other factors involved here. And these are going to vary by state and location. There's going to be cost of living expenses. Also with a private insurance carrier, which 90% you're going to be negotiating with a private insurance carrier for your charges. And they're going to be higher than the Medicare fee schedule, maybe even, you know, around 150% of the Medicare fee schedule. So we do know, for example, with this particular code, that there are some doctors that are getting a total amount of around 1,000, and we have heard of one that's getting 1,500. But it really depends on your leverage in your town and where you're performing most of your procedures as far as your negotiation. But again, you need to find someone with the insurance company that understands that you're helping them. Now, note that the total facility cost of the carrier will likely be higher. There's also, you know, pre-op visits, there's post-op visits. So there's other expenses when you have general anesthesia versus local. And again, you want to help them save money. Now, the other approach to this problem is to get into a cost accounting mode and actually calculating your actual indirect and direct costs. And we have another slide where we do discuss that, but it may not be actually necessary. You should simply have some of your direct and indirect expenses information available just in case you need it during negotiation. Also, the carrier may not need justification or research data in regard to the efficacy, the post-op time, and the safety of the procedure called Wallant, which is right away local anesthesia, no tourniquet, which is why most doctors want to perform these procedures in the office. They don't require general anesthesia or an anesthesiologist. Once again, it's better for the patient, it's quicker, and it's less money for the insurance company and the patient. So here's my hold harmless statement. Again, this coding and reimbursement information is provided for educational purposes only, and the author makes no representations and or warranties expressed or implied regarding the accuracy of the information contained in this presentation. Always consult with a healthcare attorney when establishing an OBSS. You can visit my website for more information or contact me with the email and phone number below. I thank you for your time today.